I'm here with Dr. Jeff Goodwin to ask him some questions. How long have you been a doctor, first off?
I've been a doctor since for now 7 years.
7 years? Okay. First of all, who is at risk for prostate cancer?
Well, prostate cancer disease that affects men. We start screening for men, African American men, when they turn 40, and Caucasian men when they turn 50. But men that have a family history of prostate cancer, we usually will start screening for them about 10 years prior to the earliest member of their family that has had the disease.
Okay. So you said that they should start getting tested when they're 40. How often should they be tested?
It's PSA and a digital rectal exam are the tests that we use for screening of prostate cancer. We recommend that men do that at baseline. Like I said before, white men when they're 50 and African American men when they're turned 40, and then as long as everything is fine, they do it yearly after that with the digital rectal exam and the PSA.
So PSA, is that the main test you do to check for it?
PSA and a digital rectal exam. And PSA it's a protein, prostate-specific antigen. It's a protein that's made almost exclusively by the prostate. And we know that there's really 3 reasons for that to be elevated. Number 1 is inflammation of the prostate can cause the PSA to be elevated. Number 2 is as men get older, their prostate gets bigger, and as their prostate gets bigger, it just puts off more PSA. And the 3rd reason is prostate cancer. So if you take a man that has, the same size prostate, one with prostate cancer and one without, the man that has prostate cancer in his prostate will have a higher PSA. Prostate cancer puts out more PSA than regular prostate. And so that's why we use it for a screening tool.
Okay. Are there any major warning signs or symptoms that a male can check for himself to know?
Unfortunately not. Prostate cancer is really sort of a silent cancer, and because of that, that's why we rely so heavily on the PSA test and the digital rectal exam.
What treatments do you recommend when they test positive?
Well, there's really 3 types of treatment of prostate cancer. The first treatment is, and the one that I do as a surgeon, is surgery, where we call it a radical prostatectomy, and that's where we take out the prostate, and in doing that, we do it for a curative reason. There's radiation treatments, and there's a couple of types of radiation treatments. There's the brachytherapy, or seeds that they use. They put radioactive seeds into the prostate and let the radiation kill the prostate cancer. Then there's external beam radiation therapy, where just like taking an x-ray, the radiation is shot in through the outside of the abdomen into the prostate, and that kills the prostate cancer. And those are both really localized treatments. There's some other localized treatments that haven't been around as long, such as cryotherapy, where you actually freeze the prostate and freeze and kill the prostate cells, and then HIFU, which is high frequency ablation of the prostate, and that's where you actually use ultrasound heat to burn the prostate. That's actually not FDA approved, but some people are doing it in Canada and Mexico. And then for people that have prostate cancer that's outside of their prostate, that's metastatic disease, we use hormone treatment, where we actually, prostate cancer feeds off testosterone, the male hormone, so we can either medically or surgically castrate the man so they have really 0 testosterone, and for a while that will put the prostate cancer at bay, and it won't grow or get any worse for a while.
What are some of the main side effects of some of those treatments you just mentioned?
Of surgery, the main side effect is impotency, loss of erections, as well as incontinence. We're doing surgery now with a robotic system, and it has helped in our hands to get men back to urinary control quicker, so they don't have as much problem with urinary leakage. And also we can do a nice nerve sparing procedure. The nerves that control erections run right alongside the prostate, and if we can spare those nerves, men have a better chance of getting returning good erections. Radiation has similar side effects. The main side effect in radiation, though, sometimes can be if the radiation actually burns the bladder or burns the bowel, It can cause irritated voiding symptoms where they go to the bathroom frequently, or irritated bowel symptoms where they have to feel like they have to defecate often. It can also cause scar tissue to form in the urethra, the hole that you urinate through, and that can make it difficult for you to urinate. So with surgery, you can have leakage of urine. Sometimes with radiation, you're not able to empty your bladder completely. Radiation can also cause problems with impotency, with problems with erections, but that usually happens over a longer period of time than the surgery.
Okay, I've heard before that prostate cancer is the easiest cancer to cure. Is that true?
It's a nice cancer to deal with because you can really help out a lot of patients. Prostate cancer, if it's confined to the prostate, is very, very curable. Prostate cancer, if it gets outside of the prostate, unfortunately we don't have a lot of treatment options for it. So it's a disease that if we find it early and can take care of it early before it gets out of the prostate, the men do very well. But unfortunately, once it spreads outside of the prostate, gets to the bone or to the lymph nodes, there's not a lot of treatment options.
Yeah.
So and that's a point of ongoing research.
On average, how many patients do you see a day to test their PSAs?
To test your PSAs, it's a lot. It's probably about a third of my patient load.
And how many do you think are positive?
Well, we end up having about there's about 220,000 men are diagnosed with prostate cancer every year. And so of all the men that we biopsy, we actually have a fairly high number. About 40% of our men that we biopsy have prostate cancer, and which is good. That means we're not biopsying too many people, because the higher your percentage of positive biopsies are, it means that you're appropriately screening guys to biopsy. But it also, we're probably not missing too many guys by not biopsying enough. So it's hard to say how many people that have positive biopsies or prostate cancer in a day. It just depends on the day.
Okay, since so many of your patients do you recommend any support groups for their families or for their patients?
Yeah, there's quite a few good support groups in town. There's the American Cancer Society has a group called Men to Men, and they meet quarterly, and it's a group of men that have had that have had radiation, that have had open surgeries, that have had robotic surgeries, that have metastatic disease, and they answer each other's questions. And one of the urologists in town is at pretty much every one of those meetings, or as a moderator. Monthly, Norton Cancer Center has a robotic cancer support group, and one of us is always there to talk to those guys, and that's a nice support group because all those guys either have gone through or will be going through the same thing. So every month we have people that are getting ready to have their prostates removed or thinking about having their prostates removed, and they can ask physicians questions, but more importantly, they can ask guys that have gone through it questions.
And have already experienced it.
And those guys can answer a lot of questions that, quite frankly, they can answer better than we can as physicians, since they've been through it.
Okay, well, thank you once again. This is
My
Dr.
pleasure.
Jeff Goodwin. Thank you.
All right.